What is magnesium? Magnesium is the fourth most abundant mineral in the human body, and it is an important mineral for bone structure and strength in the body, as it is possible that people sometimes need magnesium supplements if the magnesium levels in the body are very low. Fiber-rich foods are usually high in magnesium, and these foods include legumes, whole grains, vegetables, especially broccoli, pumpkin, green leafy vegetables, and nuts, especially almonds. Magnesium is very important for bone formation. It helps the absorption of calcium in the bone and plays a role in the activation of vitamin D in the kidneys and is also necessary for bone health. The optimal amount of magnesium, at the normal limit, is also associated with increased bone density, improved bone crystal formation, and a reduced risk of osteoporosis in postmenopausal women. Stimulates calcium absorption. Calcium and magnesium are important minerals for maintaining bone health and preventing osteoporosis. And in the event of a large intake of calcium without magnesium, this leads to an increased risk of calcification of the arteries, cardiovascular diseases and kidney stones. So anyone taking calcium supplements should also take magnesium, to ensure proper calcium metabolism. The benefits of magnesium for diabetics. One of the benefits of magnesium is that it plays an important role in carbohydrate and glucose metabolism, so magnesium can prevent the risk of diabetes, as many studies have proven that increasing magnesium intake leads to a reduced risk of diabetes, where for every 100 mg per day an increase in the amount of magnesium to some extent, the risk of developing type 2 diabetes decreases by about 15%. Essential for heart health. Magnesium is an essential mineral for maintaining muscle health, including the heart muscle, and sending electrical signals in the body. Some studies have shown that people who get the highest percentage of magnesium have a 58% lower chance of developing calcification of the coronary arteries. Magnesium is also sometimes used as part of the treatment of congestive heart failure, CHF, in order to reduce the risk of arrhythmia or abnormal heartbeat. In addition, patients who use magnesium shortly after a heart attack have a lower risk of death. Migraine relief. Magnesium helps to cure or relieve migraines. Reduce the symptoms of premenstrual syndrome. Taking magnesium with vitamin B6 can help reduce symptoms of premenstrual syndrome, PMS, such as bloating, insomnia, leg swelling, weight gain, and breast pain. Increases exercise performance. Magnesium helps to move blood sugar to the muscles and get rid of lactic acid that can accumulate in the muscles during exercise and cause pain, and many studies have shown that magnesium supplements can enhance the performance of athletes, the elderly and people with chronic illness. Fights depression. Magnesium plays an active role in brain function and mood, and low magnesium levels are associated with an increased risk of depression, as some studies have proven that people under the age of 65 who have low levels of magnesium have a 22% higher risk of depression, so taking magnesium or supplements can reduce depressive symptoms in some people. Lowering blood pressure. Magnesium helps to lower blood pressure in people with high blood pressure, but it does not affect people who have a normal blood pressure level. Anti-inflammatory. A decrease in the amount of magnesium is associated with chronic inflammation, which is one of the factors causing aging, obesity and chronic diseases, and some studies have also proven that people with lower magnesium levels have lower levels of the inflammatory CRP marker, and magnesium has been proven to help fight inflammation and reduce the inflammatory CRP marker. The benefits of magnesium for sex. Raises the level of testosterone. Increases fertility in men. Plays a role in spermatogenesis. It enters into the formation of bones, the structure and strength of muscles in women. Enters into the composition of the hormone estrogen. Magnesium pills for slimming. Reduces fluid retention and bloating. Stimulate insulin, which lowers blood sugar, leading to obesity. Symptoms of magnesium deficiency. Magnesium deficiency is known as hypomagnesemia, and its causes range from insufficient nutritional intake and loss of magnesium from the body. Magnesium deficiency is also associated with many health problems including diabetes, chronic diarrhea, celiac disease, and symptoms of magnesium deficiency include muscle spasm. Muscle cramps and trembling are symptoms of magnesium deficiency, and in the worst case, magnesium deficiency may cause seizures of spasm, and this is due to the influx of calcium in large quantities to nerve cells, which causes overstimulation of nerve cells in the muscles, so magnesium supplements are a treatment for magnesium deficiency in adults and younger people, while they do not work with the elderly. Psychological diseases. Magnesium deficiency causes the development of some psychological diseases such as apathy, which is psychologically defined as numbness of feelings. Depression and insomnia. Severe magnesium deficiency also causes delirium or even entering a coma. Osteoporosis. Magnesium deficiency causes a decrease in calcium levels in the blood, which is an important element in building bones, and magnesium deficiency also leads to a decrease in bone mass. High blood pressure. Some studies have shown that magnesium deficiency causes high blood pressure, which may increase the chances of heart disease. Heart rhythm disturbance. This is considered one of the most dangerous symptoms of magnesium deficiency, as a person may develop a condition of cardiac arrhythmias, which may cause some things such as dizziness, shortness of breath, fainting, and in some acute cases, cardiac arrhythmias may increase the chances of heart failure or heart attack. Symptoms of high magnesium. The condition of high magnesium is known as hypermagnesemia, and indicates an excessive amount of magnesium in the blood, the symptoms of which include affects the digestive system. One of the first symptoms of high magnesium in the blood is diarrhea, in addition to other symptoms affecting the digestive system, including stomach upset, vomiting and nausea, abdominal cramps. Affects the heart and blood vessels. An increased amount of magnesium can further slow down the heart rate or cause arrhythmias, and if very high levels of magnesium accumulate in the blood, this leads to the heart stopping beating completely, called cardiac arrest. Kidney damage. The kidneys remove excess magnesium from the blood, but if magnesium is increased in very high amounts or the kidneys have a certain disease, this leads to a decrease in the ability of the kidneys to remove magnesium. Additional symptoms, including muscle weakness, difficulty breathing, changes in mental state occur including confusion, lethargy, and in some bad cases high magnesium can lead to coma or death.